Good morning. This is Faye, and I sell Medicare plans. This morning, I am doing a live in this group just to talk to you about provider marketing. I asked if there were any questions that you had that you might want answered before we start this AEP. And the first question that I received was about provider marketing. So, the first thing to understand about provider marketing is that it's a relationship and it's better done locally. And I'll tell you why I say that. It's better done locally because you can create that relationship with all of the providers that are connected together in one area that you're working Medicare plans, which means that you can have the primary care doctor's office, the pharmacy, the vision care provider, the hearing provider, the dental providers, all of those providers connected to a particular local brand. As an example, you can take the highest Medicare Advantage plan in your area and choose a primary care provider who wants to grow their market and start with them. Then connect the specialists that they use and all of the other specialties that work with the brand that that particular provider loves to work with. Now, in that local area, you can support to those providers that you can help them by bringing them members. So it's a two-way street. Not only do you want that primary care doctor's office to have the kind of relationship with you that they will tell their patients who are turning 65 that they should be contacting you, but you also want to be able to add customers, your customers, to that doctor's office as their patient, so they're getting new patients. So it's one hand washes the other. One of the ways that you can find a provider, a primary care doctor provider, that actually wants to grow their practice and utilize a broker, someone who actually works with more than one carrier, who can bring them in new patients, is through a carrier representative. Talk to your carrier managers. See if there are doctors' offices that they have already identified who would like to have their practice to grow with Medicare patients. Another way that you can do this is to do the search within a carrier's website of providers in the local area. And if you've written business, you'll recognize some of the names because they are the doctors for members that you've already written or enrolled. Call those offices, ask to speak with the office manager, the practice manager, or the doctor to see if you might stop in and introduce yourself and let them know how you can help them to grow their practice. Just remember, provider marketing is a two-way street. It's not just to go to sit in a doctor's office in an area that they designate for you, because that is permissible and you can do that. But it is also to help them to have new patients. They're not looking for you to come into their office to just change their current patients to a plan that they already have. So think about who you can work with. It takes time to develop the relationship. It takes time to actually get to know what the provider's preferences are. Take that time to create the kind of relationship where you're going to benefit and the provider will also benefit. Then you can have a lasting relationship where when someone's turning 65 or once a month, you can have a small 1 hour, 2 hour birthday event at the doctor's office for everyone who is turning 65 and have them bring people with them. That will also help to bring new patients into the office and new customers to yourself. There's actually a free document that I have created. It's a checklist for provider marketing that is free to you, and I'll post the link for you to receive that in this group. If you have any other questions or you want to do anything with provider marketing and need help in finding those providers in your area, just reach out and I'll help you to search and find those providers. This is Faye, and I sell Medicare plans.